Hello and welcome to this session. My name is Tara and I'm one of the trainers here at Exxon Health. Today, I just want to spend about 30 minutes taking you through a couple of our new features within Surgery Connect. The first one being the Omni consultation with the voice agent, and then the surgery-led appointment booking. I will be doing some live demos just to show you how easy it is to use the software. Firstly, just a bit of housekeeping. This webinar is being recorded today for sharing purposes. And secondly, if you do have any questions, please pop them into the Q&A box at the top of the window. And also Dee, my colleague, will be popping the links that are relevant throughout the session into the chat box as well. So please have a look at those. And Dee will also endeavour to answer your questions from the Q&A box as we go through the session. Okay, so just to let you know that these features are currently available for EMIS customers only at this moment in time. So the challenges we are solving. The overwhelmed phone lines, so queues that are often saturated by routine appointments and managing those calls. We've got inconsistent data, so we've got those medical requests that are arriving in various formats, and sometimes this can lead to missing information and endless callbacks to patients as well. We've also got that fragmented workflow, so staff are forced to system hop between different software to manage triage, to manage bookings, etc. And then we've got those access to barriers, and that's where digital-only tools can exclude some patients with a lower digital literacy. Now, what we are providing is a combined solution. So first of all, the Omni consultation. This is a unified pathway that basically standardizes every medical request into a single format. So it ensures access for all those, whatever the digital literacy level. Then we've got the voice agent. Now, this is an automated artificial intelligent agent, and it captures the complete medical request data over the phone. So it's removing the need for patients to wait to speak to a member of staff. And then we've got the surgery-led appointment booking. This is secure, it's got controlled links sent directly from the phone bar, and it allows patients to book, check, or cancel their own appointments. Now let's have a look at some of the key benefits for your staff and practice. So by automating high volume data gathering and routine bookings, it frees up the team for more complex patient care, so reducing that burnout. Staff can easily introduce Omni consultations and the surgery-led appointment booking into their existing processes. And the forms section in the phone bar combines patient communications with request management. And I'll show you that in the live demo. So that's linking to smarter workflows. Then we've got direct clinical system integration. This ensures the seamless audit trails and automated SNOMED coding for both requests and bookings. So it's that automated compliance. And then the practice determines the exact slots and appointment types before sending the secure booking links to maintain that clinical safety. So again, the practice is in complete control. Now let's have a look at it from the patient experience. So it provides an identical medical request submission pass via voice, via web, or reception, so that it caters again for all digital literacy levels. So bringing total equity of access to patients. Then patients can submit requests or manage their appointments at a time that suits them without waiting in a phone queue or waiting to speak to a member of staff. So that's providing instant access. We've then got clearer, structured data, ensures patients are directed to the right care and the right clinician faster. So it's again providing faster outcomes for patients. And then using simple and easy to use tools that give patients control over their own healthcare journey. So providing patient empowerment. Now, what we're going to do is we are going to demo the voice agent. Okay, so the voice agent is designed to enhance that accessibility by enabling patients to complete the medical request forms over the phone. So it's using a voice to text technology. Once it's completed, the content of the call is captured, the response is added to the communication Windows Forms tab in the phone bar, and I'll show you where that is exactly. And it's ready for your staff to triage. So I'm going to complete the demo now. And what I need to do first is unplug the headset, just so you can hear my phone. And I'm just going to phone the Omnicon phone number.
We will now try to identify you. Please speak clearly and concisely and try to ensure there is minimal background noise. Press asterisk at any time to stop talking to our agent. Please state your date of birth.
31st of May 2006.
You stated your date of birth is 31st May 2006. Is that correct?
That's correct.
Thank you. We have found your details. We will now ask you some questions about your call today. Please speak clearly when answering questions and ensure there is no background noise. Our agent is limited to 10 minutes to capture your answers and is limited to 1 minute per answer. We will ask you to confirm each response you give. Is this regarding an existing problem? Please state yes or no.
Yes.
You have stated this is an existing problem, is that correct?
That's correct.
Please describe the medical problem you're calling about today.
I have a really sore throat and there looks to be lumps appearing at the back of my throat.
I've recorded that you're calling about, I have a really sore throat and there looks to be lumps appearing at the back of my throat. Is that correct?
Yep.
How long has this problem been going on for? Is it getting better or worse?
About a week, and it's definitely getting worse each day.
To confirm, you stated about a week, and it's definitely getting worse each day. Is that correct?
That's correct.
Have you tried anything to help improve the problem?
I have taken paracetamol to try and ease the pain.
You have stated, I have taken paracetamol to try and ease the pain. Is that correct?
Yes.
Is there anything that is particularly a worry?
I am concerned it's getting worse and I will need time off work.
You have stated, I am concerned it's getting worse and I will need time off work. Is that correct?
Yes.
Tell us in a few words how we can help.
I wonder if I need some stronger medication, perhaps antibiotics.
Thanks. I have captured, I wonder if I need some stronger medication, perhaps antibiotics that are antibiotics. Is that correct?
That's correct.
Could you please tell us the best times to contact you?
Any time is fine.
To confirm, the best time to contact you is any time is fine. Is that correct?
Yes.
Thanks for answering all of our questions. A member of the practice staff will get back to you regarding this problem.
I'm just going to put my headset back in and hopefully again. So that's the demo complete. I will go through the medical request on the communications window in a moment. So right at the beginning, it did say there was 10 minutes in total to complete the form. And you may have noticed with all the questions that the answer was repeated back for the patient to confirm. So it's basically a question, answer, confirm, question, answer, confirm. Now, this process ensures a high quality automation, but without the difficult compliance standards that are needed. You'll also maybe notice a change in the prompts between the beginning prompt and then the voice agent. You can, the practice can customize the prompts at the beginning and at the end of the process. And also you may have noticed the different types of confirmations. So yes, yep, that's correct. And that also shows you how the voice agent is able to handle a different number of types of responses. Also, at any point, the caller can leave the process by pressing the star key. And this will be shown as a partially completed response, and it will be added to the incomplete tab in the communications window forms. Okay, so now I've just quickly gone through the basics. We're going to now have a look at the actual request in the Omni Consultations centralized platform, and I'm going to walk you through the forms section. So what we'll do first is expand the phone bar and click on the communications window here. And click on the Forms tab. And what I'm going to do first of all is expand that window so that we can see everything. So first of all, we're in the Waiting tab, and you'll see all of the medical requests down the left-hand side here. We've got two are unread and new that have popped in. This is the one that I've just done now. Also, you'll see there's different icons. So these are the different types of medical requests. So we have the voice agent, so it's like a speech bubble with a plus sign. Then we've got the one that looks like a small web page. And this can be via a link through a text message or a link on the practice website itself. And also the last one is this one here that looks like a page with a person in the middle. Now this is a blank form and it's available for staff to complete manually on behalf of the patient, and that could be via the telephone or face-to-face. So it captures the same structured information. So I will just show you what that looks like. If I just click on create new request, you can see if I just scroll down, these are exactly the same questions as were on the voice agent as well. And you can assign a patient as well. Okay, we're not going to go through that today. We're going to look at the voice agent. So I'm just going to cancel out of there and discard changes. So first of all, we're going to click on the medical request that's come in. Now, as soon as I click on the medical request, you can see it's got my name, Dr. Tara D, underneath it, and it immediately assigns that medical request to myself. If I go right over here, you can see it's been assigned to me. Now, if I just wanted to go in, have a quick look, and then unassign it and mark it as unread, I can do. I can just right click on the medical request, mark as unread and unassign. And there we go, back to unread. So I'm just going to click on it again and it's assigned me again. Okay, so what do we see? This central panel here is the actual request details. We've got the number, the communication methods, the patient details, and it's just reminding us it is a voice agent generated, the date and time, and then we've actually got the response audio here. We've got the actual request, and here's the actual transcription if you needed it. Okay, so that's the request details panel. Okay, then we're going to go on to the action request on the right hand side. So as I mentioned before, this medical request is assigned to myself. If I wanted to unassign it, assign it to somebody else, I would just first log back in to EMIS. And let's just pull that up again. There we go. So it's assigned to myself. If I'm thinking this maybe needs to go to another clinician, I can click on my name and I'm going to scroll right to the top and select Sally Brooks. Now, I've assigned Sally Brooks, and Sally will be notified via an email. This can be configured in your phone bar settings, and Dee will pop the link into the chat box for you. And also, if I wanted to reassign it to myself, we can do that there. Okay, so just at the top here, we've got status is waiting, and that corresponds with in the waiting tab here. Then we've got priority and severity. Priority is linked to the patient, so I'm going to pop it in as a high priority. It's an elderly patient, and we've got severity, and that's linked to the illness. So here I'm going to pop in medium. Okay, so we've popped all that information in. Now, if I just look at the bottom of the action request panel, you can see there's activity. Now, this is a full audit trail of everything that happens to that individual request. Okay, so we can see here I have set the priority and severity. I've also assigned it to Sally. The actual request has been created, etc. And then to the right, you can see we've got comments. So you have up to 100 characters. I'm just going to pop something in there and I'm going to save. So anybody in the surgery who's got access to this will be able to see the comments. They will be able to make comments as well. I can, if I want to, delete or edit the comment. Okay, so I'll go back to activity. Now also we've done, I think, everything we want to do here. What I'm going to do is I'm going to move it to triaged. So here I just select on status and click on triaged. You might see now that this medical request has disappeared from the waiting and it's now in triaged. There it is. Now there's a lot of triaged medical requests here. I just want to find out the ones that are assigned to myself. So I'll go to filter and assignee and assign to me. So that's a much more reasonable list for me to look at. I'm going to select the top one. That's the most recent one. And you can see the triaged tab is very similar to the waiting tab. Okay, I've got my request details here, exactly the same. And then I have got my action request details here. Now you may notice one slight difference. We have the save to record option here, and this is where you can save it to EMIS and the patient record. So what we can do from the triaged tab is we can select codes, the SNOMED codes. So I'm just going to click here and I'm just going to select one or two, and I'm going to add an observation, add code. You can add up to 3 SNOMED codes and comments as well. So you'll also notice you can delete them here. Okay, I'm going to close that SNOMED modal window, and you can see we have got 3 selected codes here. Now they're not listed here because they are listed in the activity tab underneath. Okay, you can see them all there. So now we are ready to save to patient record. Now, what will be saved over to the patient record are the response or the medical request itself and the SNOMED codes. The activity tab and the comments won't be saved. These are for internal processes only. Okay, so when I'm ready, I'm going to tick the box and click Save to Record. once we've done that, I will show you what it looks like in EMIS. And here we have the medical record into Sheldon Cooper, and this is the voice agent with the SNOMED codes. Okay, so that's what it would look like. Right, let's just go back to our communications window and forms tab. There we go. So to basically close that loop of efficiency and integration, what we can do from now is we can create a surgery-led appointment booking. So once we've completed, we've saved to the patient record, we can go up to the communication methods and click on the SMS icon. So I'm just going to click there. You'll see it's pulled the patient record through. You can, if you want, use a message template, or you can just type in a customized message there. So I'm just going to use a message template. As soon as I've clicked into the message, you'll see that the add booking link becomes active. I'm just going to click on add booking link. Then we can select the appointment slot type. You can select whether it's a face-to-face or telephone, and also you can select the booking link expiry. We're going to keep it to 48 hours. And then we apply. And there's the booking link. Okay. Then we're going to send that SMS. Now, because this is a test system, it won't actually physically send it. So I'm just going to cancel out of that window. However, it is linked to the comms window. So it does, in the activity, tells us that that SMS has been sent. Okay, so it is part of the audit trail. So once that's done, that's really easy. And now I want to show you the patient experience, what the patient experiences from their side. So I'm just going to minimize that. And this is just a short video just to show you. So you can see here, the patients received the text. They're now confirming their identity. And they've got the next available appointments, the dates and the times. And there we go. Really easy for the patient. Now I just want to go through quickly and easily how to set up and use the voice agent in the Xflow. So for the voice agent to work correctly, you need to have two blocks, and those are the assigned patient block here and the voice agent block here. You can add these into existing call flows wherever you like, for example, the main line, wherever it best fits your current practices. So I mentioned before about having a prompt at the beginning. There you go. That's to introduce it. And then the next block will be the assign patient block. And this just makes sure that the caller is a patient at the practice that they are ringing. Okay, once they've been identified, it goes through to the success block and then moves through to the agent block. And the agent block is where the main functionality of the voice agent takes place. Once that's completed, it then goes through where the user has then answered all of the agent's questions. And then it can be taken, the user can be taken wherever the practice wants. So the line could be hung up, or it could then go through to reception if the caller wanted. Okay, so that's it. Really easy to set that up. Now, there might be one other thing you would like to consider, and that's something called Surgery Assist, which is our digital support assistant. What this can do is help drive demand that doesn't necessarily sit in the practice, but to other community services that might be more readily available and relevant. So it could be, for example, PCN services, community pharmacies, or self-service. And this can help reduce the number of medical requests submitted via the Omni Consult form. So if you'd like more information on Surgery Assist, you can have a look at our website. And the link will be in the chat box. Dee will pop it in there for you. And also, if you'd like to register your interest with Surgery Assist, Dee will also pop the form into the chat box as well, so you can get in touch. Now, to help you chat and discuss this new technology with your patients, we do have some resources for you to use in your practice. So, for example, across your social media, everything from posters, short animations, information for your TV screens. These are also hosted on our academy as well, so do have a look at those. Dee will pop the link in to the patient-facing resources for you, so please have a look at those. Now, this is really the end of the webinar session. I do hope you found the information and demos useful. In terms of next steps, if you want to learn more, you can contact your customer success advisor if you've got any questions. Or if you're interested in hearing more about the Omni consultations or the surgery-led appointment bookings, you can register at the links that Dee has popped in the chat box, or you can visit our website. And we do have a short academy course that is available on navigating the Omni consultation forms, and it covers everything that I've covered today. It takes about 30 minutes, and also you get a CPD certificate at the end, and Dee will pop that link into the chat box as well. Okay, so what I will do is just have a look and see if there are any questions. And let's see. Got the chat. All the links are in the chat. And let's see if we've got any questions. No questions. That's great. Hopefully I've explained everything. Well, thank you very much for attending today's webinar. Thank you from myself and Dee, and we look forward to seeing you again. Thank you very much. Bye-bye.